Okay, right. Hello, everyone. My name is Funto, and welcome to the Work Experience webinar. So I believe there's a group chat box in the corner, and you guys can leave your questions in there, and we'll see to the questions at the end of it. So I'm going to spend the first sort of 30 to 40 minutes just talking about work experience for medicine. I'll talk about the types of work experience out there, how to actually organize and get the work experience, how to make the most of it, what sort of things to do on the work experience, and then we'll then take questions and answers for the last 30 minutes or so of the talk. So I'm going to share a screen with you guys now. If you can't hear me properly, you can leave a message in the chat box, and we'll try and fix that. All right, just going to share a screen. Bear with me. Okay. So I'm going to start with talking about the types of work experience. So a lot of people, when we talk about work experience, they seem to think that work experience just means when you're actually attached to a doctor and you go into, a hospital ward or something, and then you follow them around throughout your time in hospital, maybe for 5 weeks or not 5 weeks, 5 days or a week. But that's not the case. Work experience it means anything. It can mean so many different things. It can be paid, it can be volunteer, it can be work experience placement, where you actually attach to, a doctor in a hospital ward for a few minutes. It can be healthcare related or not healthcare related. So we're talking care home, hospices, hospitals, those are obviously healthcare related, but you can be teaching somebody, or you can be volunteering as a befriender or telephone volunteer. Things like this are non-healthcare related, but they are work experience because it's where you put yourself in an industry, working alongside employees of that industry, learning about how to provide the services that industry provides, or developing skills in yourself to use later on in future with the hope to actually work for that industry. So I hope that makes sense, but that's the whole point of work experience. And you need to have it for so many jobs, especially medicine. So it can be abroad or it can be at home. Now, you don't get brownie points for, having work experience abroad as opposed to in this country. If anything, if you're going to work in the NHS, you definitely must have work experience in the NHS, but you don't need work experience abroad. But if you do have experience abroad, so maybe you volunteered with Gap Medics or something, or maybe you just did some shadowing while you were in India for a few weeks, or with relatives or so. You need to be, one good thing you can do is that you can compare the healthcare systems. So you need to find a very good example of a patient that you found abroad, that a patient that you wouldn't normally, that will be so uncommon to find in the UK, and then use that as a good example, be able to discuss the ethical issues surrounding things like paying for healthcare versus free healthcare, be able to discuss things like the inverse care law, and just any other issue that of social inequality and how it affects health. You need to have to talk about these fluently. But these are also examples that you can actually find without doing any work experience abroad. So just something to bear in mind. You don't need to run out of the country to do work experience. The key thing with the type of experiences that you do is that you actually have a mix. So we recommend doing things like having some primary healthcare work experience. So this will be things like GP practice volunteering, or shadowing a GP practice. Have some secondary healthcare experience, so hospitals. That's definitely key. Do some voluntary roles, do some paid roles. Have a mix of things, and definitely work in the community as well, especially long term. So we're talking 2 months minimum in the community. This could be volunteering to mend fences, or just volunteering in your local care home. Just doing something, because it shows commitment over a long period of time, which is arguably more important than 5 days in a hospital following a doctor around. Now, the work experience itself, every university will tell you to do it, and it is extremely relevant, but the reasons universities ask you for work experience is that they want to see, they use it as evidence. Your work experience needs to show that you're actually motivated, you want to study medicine, you have an interest in healthcare, which is why you've gone out of your way to, find this work experience and follow these doctors around, and you paid attention, you developed these skills, you learned this and that. You need to show that you're interested and you're engaged in your wider community, which is why you volunteer with your local hospice or or do something in the community for a long term, you need to show that you're committed to caring, because how else are they going to know that you're a caring person? So it's there to provide you with evidence that you can put down in your work, in your personal statement, as well as talk about in your interview. And one really good thing about work experience, depending on what you do, of course, is that you can gain some real insight into the medical field. And because everyone can just read about it, we can read about the pros and cons, but when you actually undertake work experience in a hospital, you get to find unique examples of, a situation that showed you how medicine is not all rewarding, it's not all, learning about interesting things every day. It's actually physically demanding. You could be in theatre standing for like 6 hours and feeling faint. But that's one extreme. Another extreme, or actually a more normal thing, is junior doctors walking up and down the ward, or from walking up and down the hospital from ward to ward. You clerk up some serious mileage while doing that, and you realize that it's quite physically demanding rather. It's mentally demanding, because you have to balance a lot of things. You have to juggle a lot of priorities. There's a lot of responsibility on you as a doctor. It's emotionally challenging, of course. I mean, you're dealing with sick people, you're dealing with people's lives, you're in an environment where there are a lot of emotions. There are angry relatives, there's sad people, there are dying people. There are times where you'll feel helpless. There's nothing you can do about a situation, and you just need to show that you're aware of these things, and you would get that through work experience. You'd also come to realize that when you get into medicine, a lot of your success, or a lot of your ability to do well in the field, actually requires self-sacrifice from you. You will sacrifice a significant amount of your personal life that will be dedicated to studying or training or patient care. And you will need proper examples of this. And the only way you get these examples is by doing some work experience and having something to talk about in your interview and your personal statement. So it is very useful. You'd also develop transferable skills and attributes that you want in a doctor. And this, I hope you can all see the slides, by the way, but this is just a very, very short list of skills. There's a massive list of things that you need to have, and in addition to competencies, as a doctor. But it will include things like teamwork. You need to work with a diverse range of people, because as a doctor, you work with nurses, physiotherapists, occupational therapists. You work with the patients. In the NHS, you see all sorts of people. You need to be able to prioritize and manage your time properly, because you won't have any time when you have a lot of paperwork and a lot of responsibilities on your hand. You need to be able to handle responsibility, and a really good way to show that actually is by having a paid job, and a paid job where you actually also use your initiative. That would be really good. You need to show insight into yourself. And this one, I really quite like this. And it's something a lot of universities are sort of, they're tagging onto now, because when you do, a volunteer role or a work experience placement or something, obviously you're going to reflect on it. We'll talk about that later on, but you reflect on it. And as you reflect on it, you learn things about yourself. Well, you should learn things about yourself. You should learn your weaknesses, your strengths, see where you can improve yourself more, see what things you're better at than others. You learn about yourself, and you see if, this is the sort of person I am right now. Can I really become a doctor later on? Is this a skill I want to keep having? Is this something I really need to work on? Is this a bad habit that I really need to get rid of? You get insight into yourself, but also that links in with being aware of your own competencies and the limits of your competence, because one of the most dangerous medical students or doctors you can have those that are not aware of the limits of their competence, because that really jeopardizes patient safety. But if this is something that you come to identify when you're actually working with people, and you begin to realize how skilled or unskilled you are. So it's something that you need to develop, and it's extremely transferable. You get to exercise empathy. Now, I think you need to know the difference between empathy and sympathy. Of course, empathy is being able to, put yourself in somebody else's shoes and almost feeling with them, or you attempt to feel with them anyway. You can never really truly understand what they're feeling. But in many situations, there isn't anything you can do except just be there for them. And that is one way to show empathy. And this is a skill. It's something that you get better at doing by practice. And you will find golden examples of you being able to show empathy when you're on placements, particularly in like hospices and hospitals and places like that. You need to show that you can take the initiative, you can lead teams, you can manage stress, and there's so many other things that you need to show through your actions to the universities that you apply to. So how do you actually land the work experience placement? Well, not necessarily a placement. This can just be a volunteering role, like I said earlier. As you do your search for the position that you or the opportunity, you also need to start working on your CV. Now, the CV needs to show that you're a dedicated student and that you're also busy, because there's a saying that goes, if you want something done, give it to a busy person, and that's quite true, because there's something in the attitude of being busy. You're sort of more motivated to actually do more. It shows that you're getting somewhere. You're doing something productive with your life. And when people look at your CV and think, oh wow, you're only 16 or something, and you're doing all of these things, you've accomplished a lot already, they actually develop respect for you, and that's what you want. You're not going to, employ somebody who you have no respect for, or who you think are just wasting wasted the 16 or 15 years or so on the earth so far. So your CV needs to be good. So, and you should try and obviously include your grades, or your predicted grades, include any awards that you have. These don't have to be academic, by the way. Include any qualifications, any presentations you've done, presentations as in anything out of the ordinary, not just the day-to-day presentations that you give in your biology class or something, anything special, presentation to a whole school, to a large audience of people, any conferences you've attended or even helped to coordinate. And if it's medical, it's obviously even better, and if it's not medical, it's fine. It's part of organization skills. So you develop transferable skills from this too. And it shows motivation and willingness to learn, engagement in your wider community. Include publications that you may have, extracurricular activities, hobbies, interests. All of this just helps to show that you're a well-rounded person. And that, again, you like to keep busy, which is good. And career intention. Now, if you don't know what you want to do in future, if you just know that you want to be a doctor, that's okay. But if you do have a career intention, like you want to be a radiologist or something, that's fine. You can put that down too, but just try not to sound close-minded in the way you phrase it. And of course, include your referees, or you can say referees available on demand, and get your tutor to proofread your CV for you, or somebody who writes a very good formal letter. It doesn't have to be a tutor, but somebody whose letters you would read and respect. Let's put it that way. Get them to proofread your CV for you. You need a cover letter as well. So this cover letter should be adapted to whatever position it is that you are applying for. So you will need a cover letter for, applying to volunteer in a care home. You need one for going to, maybe one that you want to email to doctors when you want to request shadowing them. And try and address certain questions. So questions like why you want that position, why they should choose you, what you're hoping to develop, what skills you're hoping to improve on in yourself, or what you're hoping to discover about yourself or gain from the experience. And of course, you want to show admiration and keen interest in the organization. And by that, I mean you want to, so say, for example, you're applying to you want to volunteer in a care home. And let's say in the last year, your grandma was in a care home for the last 5 years of her life or something. And let's say that you actually did think it was a very good home, and the care staff there were very supportive. They kept her energetic. They played games with her. They helped make the last few years of her life fun filled, and she had a great time there, and it really made a difference to her quality of life. If you write about something like that, or if you reflect on that through your writing in your cover letter when you're applying to a different care home, you show admiration. You show that you respect the work that they do. You admire the work that they do, and you want to be a part of it. You want to help improve the life of other people, the quality of life, rather, of other people by doing the jobs that they do, because you recognize it so much and you admire it. So you need to sort of, I don't want to say boost your ego, but really that's kind of what you're doing. But hopefully you actually do believe that, and you're not just saying it to get the position. So show admiration, show keen interest in the organization. So know about the organization, know what they do, and of course thank them, and get the letter proofread before you send it off as well. Then prepare yourself for the position. I mean, that goes without saying. So that means familiarizing yourself with relevant laws or rules. So if it's in a healthcare environment, you need to know things like confidentiality, and when you can break it, when you can't break it, and the fact that if you're going to break it, you need to let the patient or the client know. You need to be aware of safeguarding issues, like safeguarding of vulnerable people. So particularly for working with elderly people or people with learning difficulties or young children, you need to be alert, look out for any odd bruises or any change in behavior, things like that. You need to just be aware of these things. I mean, they'll make the interview or the informal discussion, as it's called, that you would have with the employer go much better. And it also shows that you actually, you're interested. You'll be a good addition to their team if you're aware of these things. And read about the role and the opportunity. I mean, again, that goes without saying. You need to know what you're getting yourself in for, and you need to show that you have the right attributes. You meet the person's specification before you actually apply there. Then you need a reference letter from your school or from your tutor or your employer if you already have a job. And this needs to be somebody who would, of course, write your shining character reference. You don't want them to assassinate your character. And it also needs to be somebody, well, preferably somebody who knows that you're going for medicine, who knows why you're doing all of this extra, work, because then they can write about attributes and skills that, hope that universities or doctors would want in a medical student or a doctor. And that really looks good because it ties in with what you're saying about yourself. So get a reference letter from a school tutor or an employer who knows you, who knows of your intentions, and who would write you a very positive letter. And as you go around searching for work experience, which I think we'll talk about in the next slide, you would take with you your CV, your cover letter, your reference letter. Those are 3 key documents that you should have with you, and just give them to everybody who you think will help you. And of course, get a smart outfit. I mean, when you do land some work experience, if you land a work experience placement, you might get a uniform, which is really helpful because it identifies you to everybody else who you'll be working with. But if you don't get a uniform, then you obviously need to look smart. So get smart outfits. If it's going to be in a clinical setting like a GP practice or in a hospital, be below the elbows, tie your hair back, etc. You look like a professional, basically. So I think the search is probably one of the hardest things, actually being able to find work experience and apply for it and get it. Now, it's a lot easier to get work experience in hospitals than it is in GP practice. And I'm not entirely sure why that is. I mean, a lot of GP practices some of them anyway, would say things like, well, this is your local GP, so chances are you might know a lot of the patients here. We need to respect confidentiality, things like that. And many of GP practices also have many medical students, but that's not the whole truth. So I'm not entirely sure what's going on there. But anyway, it's easier to get work experience in hospitals, and you should absolutely get work experience in hospitals. So many NHS hospitals, in fact, I think I can probably say all NHS hospitals will be under some sort of NHS trust. And the NHS trust they will have a website somewhere. You need to find the NHS trust website in your county or your city or what have you. And each NHS trust would have at least one hospital. They may have a number of hospitals under them. And each hospital under the NHS Trust may have its own website. So as you search through the NHS Trust website, also search through the NHS hospital, the specific hospital website. And when you search, you can literally just type in keywords like work experience or shadowing or volunteering, and you will be trolling through pages and you would find something, because the hospitals do try to advertise the placements online so that you can just get it yourself and sort out all the forms and just send it to them, and then they don't bother replying you. But anyway, check it online because it's usually there. So search for the NHS Trust websites, search for the hospital websites, not just the teaching hospitals, search the community hospitals as well and small hospitals. Just search everywhere. Any hospital you hear about, type in work experience, shadowing, volunteering. If you find a form, fill it out, contact them. There's usually a contact email or a number, use it, or you can ring the HR department of the hospital and ask them about work experience. They might give you a completely different contact information, which is fine. Use that as well. Chase it up. Use multiple lines, basically. Don't just rely on one route and wait until that works out. Chase down multiple routes at the same time. Some hospitals, especially the big ones, would have a list of consultants that work there. And they're not going to put the consultants contact information out there, but they usually will put the name or the email address of the consultant secretaries. Now, that's very useful, and you can contact the secretaries, ring them up or send them an email, explain your situation, let them know you're preparing to get into medicine, or you're an aspiring medical student or a prospective one. Show that you're keen, speak professionally and clearly to them, and let them know that you're interested in shadowing Mr. Blah blah blah, or the consultant, and ask them for their advice. Ask the secretaries for your advice on what you should do next. There might be a form for you to fill in, and they might send it to you. They might ask you to send them an email. Just do whatever they tell you to do, because you want to chase that line up. And if they do tell you to send something, once you've done that, follow it up with an email. Well, so not an email, follow it up with a phone call rather. Check that they've got the email, because chances are, these people are busy, and your application or your desire to shadow the doctor sort of falls a lot further down the line than you'd want it to in their eyes. So you need to chase them up. You need to be persistent. So phone calls, check that they've received it, check on how the progress is, check on what else you need to do. And of course, try other consultants. Don't just wait for one person to get back to you to say yes. Try 10 of them at the same time. And hopefully one person will say, yes, come next week. So that's what you need to do. You have to be very proactive with that. With the HR department, I think I've already mentioned that, yeah. So contact them. They may give you a different set of contact information for chasing, work experience. It may or may not work. If it works, great. If it doesn't, no problem. There will be other contact information on the website. Again, just come through the websites. With GP practices, now, they're trickier to do. Your best bet is to have your CV, your well, actually, I can't say your best bet, it may not be. But anyway, have your CV, your cover letter, your reference letter, go up to your GP, look professional, speak to the receptionist about work experience opportunities there. If she doesn't know anything about it, ask if you can speak to the manager about it. Hopefully the manager will be around, or they can arrange an appointment. Have all your documents with you, submit it to the manager, talk to her about it. If that works, great. If it doesn't work, it's okay. Next time your relative has an appointment, go with your relative. That's what I did. I went with my mother when she had an appointment, and at the end of the appointment, I just asked the doctor if I could come and shadow a couple of days. I told her I was studying medicine, etc. I said, yes, sure, that's fine, and that's what I did. And then she gave me the contact information of another one of her friends who was a hospital actually was a hospital doctor, a consultant actually, and then I was able to go shadow him as well. So do things like that. It sounds a little bit like you're ambushing the the GP, but you got to do what you got to do. So yeah, try that as well if the reception or manager route doesn't work out for you. And another thing I did was to use walk-in centers. Now, where I lived, I didn't even know this working center existed in the city area, but some random day I walked past it and I thought, hang on, they have doctors in there, and they have nurse practitioners in there as well. I could definitely shadow them. And so I came back the next day, had my CV, cover letter, reference letter, went in there, spoke to the receptionist, asked about work experience. She said they didn't do that. I asked about the senior manager, and it was very nice, very professional. And luckily the manager was around for them that day. And so, yeah, she just said, come around the back. And so I went in, saw the manager, sat down with her. And that same morning, the manager arranged a timetable with me, and I was able to start shadowing them the next week. So seriously, try this, just try it. That's all you can do. Now, voluntary positions, of course, this can be healthcare related or non-healthcare related. You need to definitely try the NHS hospital website, so searching for volunteer, because what you want is work experience where you're working with or alongside hospital staff or patients. You need the patient contact. You need a hands-on experience of actually talking to patients, doing things with them, for them, and helping the hospital staff. So try and get voluntary positions within the hospital. So ward volunteer, mealtime assistant, ward visitor, positions like that. And you can try websites like the Royal Voluntary Service. Now they do befriender schemes and skill swap in the community that you can do long term, which is great because it's just commitment to care. but they also have they do have some sort of in-hospital visit positions. It just depends on where you are. So you may also get to go into hospital with the Royal Voluntary Service. Try organizations like MenCap, try your special needs school near you, take your documents with you, ask to see, speak to the receptionist to volunteer there, help the teachers, and you'll be working with the students. Teaching is a wonderful skill to have if you want to come into medicine. So try and get that teaching, and teaching of people who really need extra support is what you need, as opposed to just teaching regular people. If that makes any sense, and hopefully that doesn't sound too insensitive. Try the Do It website. They usually have a load of opportunities, volunteering opportunities out there, so you can just apply for multiple things and pick and choose. Go to your local care homes, your hospices, speak to the managers, volunteer your time and your skills. Basically, that's all you need to do. So, or you might, when you get to talk about volunteering in a place, all they may want, all the service users or residents may want, is for somebody to just sit with them, listen to them, just keep them company, maybe assist them with putting their shoes on, or food or something, play board games with them, just keep them company and just listen, and you will develop those interpersonal skills and communication skills and simple things. You develop the ability to build a rapport with patients or people, which is what you really need as a doctor. So try those. And fingers crossed you would get on to actually getting some work experience. And then what do you do once you have the work experience? Well, you must have heard of keeping logbooks, and it's, of course, very, very useful. I highly recommend it. But when you keep a logbook, now the point of a logbook is that you write down the events that have happened and then you reflect on these events. It really helps I think it's a lot more useful to write to make notes on the important events, so things that are interesting or memorable, or things that stand out to you and motivate you to do something, and then you go and do something about them, as opposed to just a logbook of every single activity that happened that day. Because if you have to reflect on every single activity that happens that day, it can become quite dull. I've tried to do that and it didn't really work. But what I did was I kept a logbook of what I actually thought was interesting, events that stood out to me, was memorable, something that was different, something that I didn't really expect. And then you can expand on your reflection. You can really look into this and analyze everything that happened that afternoon. And you need to figure out, or you need to, whenever you come across something, so let's say you spend an afternoon as a volunteer ward visitor and you'll spend an afternoon with a patient who was dying from ovarian cancer that's metastasized. So and let's say she's completely weak, she doesn't speak, she's just in bed, she occasionally sips on a drink and she's dying. And let's say she has a husband with her, this elderly gentleman who's a little bit distressed or something, and then you spend time with both of them. So you listen to the husband, you try and just be there, just console him, be a shoulder for him to cry on. That's all you're there for. You occasionally feed the lady water or something, and you're there to just, I guess, in that moment you are empathizing with the husband. You're empathizing both of them, actually, and that's good. But hopefully, as somebody who's 16 or 15, I may not know very much about ovarian cancer or the management of it. Hopefully that will motivate you to go away and read about ovarian cancer, read about the epidemiology, the diagnosis, the etiology of it, pathophysiology if possible, and how you actually treat it or manage it. Because it's such an easy interview question. Like, I got asked that at all of my interviews. I got asked, so tell me about something from your experience that stood out to you. And then I give an example and they said, okay, so what is aortic stenosis, or what is this? And if you had not done your homework about, this condition, because the interview can become quite clinical all of a sudden, and if you've not read around it, as they would expect a doctor or a medical student to do, then you're going to get into hot water quite quickly. So keep a logbook and definitely keep note of what that event has motivated you to go and do. So set goals if you can. Actually, I highly recommend it. So maybe a few days before your work experience, or a week or so, make notes of a few things that you would love to achieve during the course of of your volunteer work or the work experience. And if possible, inform the supervisor or whoever you've been attached to, because they might be able to help you to achieve them. And that would be really good. You can write about that. Keep track of the dates, the times, the hours spent, because some universities, when it comes to actually sending in the application on UCAS, some universities may send you a form to fill out, and in the form you may have to include the hours you spent doing this each particular work experience. You may have to include your supervisor's contact information, because they're going to verify that you actually did do the work that you say you did, and so you need a logbook of that. When you're out on your placement or voluntary roles, with the patients, with the staff, just everybody, ask questions, show enthusiasm, and it's important, I think, to read extensively about anything that you come across. Just read about it so that when they're talking about it the next day or later that afternoon, you understand what they're talking about, and then you can either contribute to the conversation, or you can ask intelligent questions. So, your question, even if you don't know anything about it, don't be afraid to ask a question. If you're worried that the question may not be intelligent, don't be silly, just ask it. I think the most stupid question you can ask is one that you already know the answer to. So if you don't know the answer, ask the question. But if you read about it, then you can really go into depth. You can carry on a conversation with a doctor about a particular condition or a patient, and you could fascinate them. That's my point. So ask questions, show enthusiasm on the work experience placement, and you'll enjoy it much better. Get involved, because when you're on the work experience placement, they might put you, especially if you get one of the clinical attachments that you'd apply for through the trust, they'll probably attach you to a doctor or a team of junior doctors or so, and you are part of the team. Act like it, join in, listen to them, ask them if you can help. What can you help with? Maybe you can just help with fetching the files. Maybe if you're in clinic, you can get up and call the patients in, introduce yourself to the patient, show them where to sit, shut the door behind you. Be of some use. Don't just sit in the corner and quietly observe. Join in, do something, learn something as well, and keep an eye out for golden opportunities. And by that I mean things like audits and research opportunities. Especially if you're in hospitals and you're working with junior doctors, there's always some sort of research or audit going around that you can join in and be a part of, like collecting data for it, for example, which is something that not very many prospective medical students get to do. And so to really stand you out from the crowd if you do something like that. And of course, self-reflect during the work experience. And yeah, seriously, don't look bored. It doesn't go well. Just don't look bored. Whatever it is, just don't. After the work experience, ask for a reference letter or a letter of acknowledgement from, whatever the organization is, just something you can add to your portfolio as evidence that you've done this. And hopefully, because it's a reference letter, hopefully they would be able to talk about your character and the way you conducted yourself during the placement. Hopefully they can write very nice things about you, and you keep a record of it, because you might have the opportunity to submit it later on. So with some medical school interviews, there might be, even if it's a multi-minute station, there might be a station where they tell you to bring in something and present something about yourself, and you may just be able to drop a copy of your portfolio there to leave it with them as well, which they might flip through, and that might just be the extra brownie points that gets you the offer. So keep a logbook, or rather keep a portfolio of reference letters from the different placements that you undertake, and of course maintain a good relationship with them, because you may want to return to them as a future employer, or you may need them as a referee for later on, or summer jobs or something. Just be on good terms with everybody that you come across with, basically. So this is a slightly difficult part. What to do when they say no? I think the first thing to say is actually don't be discouraged, because it's so common. I mean, I think I'm trying to remember I don't know how many times I got rejected, but I got rejected lots and lots of times. My main hospital placement in the end was actually a job as a healthcare assistant, because I could not really get hospital placement until after I'd done the GP shadowing, and then I got to talk to GP, and then she referred me to a friend, and I got to shadow her, the consultant in the hospital. But before then I had nothing. I had so many rejections, and that was a lot of that I think was just because I was a bit late to finding out that I should be searching for this and applying this. You need to start really early. But anyway, it happens. You'll get rejections from some places, and if you do, it's no big deal. Just find out why you were rejected and try again. Try a different place. Try a different consultant, a different hospital. Don't be afraid to expand your search. Try looking in nearby cities. Use different contacts. So you will know somebody who knows somebody who knows a doctor that you can go and shadow. When you attend conferences and things like getting into medical school events, ask the organizers, ask the doctor, ask the medical students. You might know somebody that'll say, yeah, sure, come along to my hospital or to my clinic, and I'll take you under my wing for a couple of days or something. And if they do that, on the second day, when just before you, not just before you leave, but the second day, ask them if they can recommend another doctor that you can observe for another couple of days or something. And don't just observe, ask to actually do things. So volunteer, just find out what volunteer roles you can actually fulfill in whatever environment you find yourself in. So yeah, take opportunities as they present themselves to you, or as you wherever you are, take an opportunity you can find. Try again, be persistent, and just don't be discouraged. That's what you do when people say no, and you'll eventually get it. But just bear in mind, it can be pretty tough if you have no contacts in the field, but it's completely doable. And as I said earlier, work experience, it's so broad, it can be anything. It does not have to be healthcare related. You can develop the same transferable skills by working in a shop or, doing other things. It might be a bit more difficult, but you just have to do it long enough and in the right environment, and you'll find examples that you can use in your work, in your personal statement or your interviews. So don't be discouraged by it. All right. Any questions at all? Just going to have a look to see if anyone has any questions. You can just type the messages in the group chat and I will try and answer them. And I don't know if I think a lot more people have joined than I started with. So I introduced myself earlier, and I go to University of Sheffield. If you have any questions about maybe University of Sheffield, you can also ask, and I will try to answer that. And I hope you actually found that quite useful. Just going to turn the feedback up. I can see some more people are joining. Well, I finished the presentation now, and if anyone has any questions, just feel free to ask in the group chat, and I will reply here. And if not, well, thank you for watching. And if there's anything you think I should probably go over, you can say so as well. And by the way, your questions don't have to be specifically about work experience. You can just ask about medicine, medical school, just anything in general, and I'll try and answer. In the meantime, I can just put the, what's it called? I'll put the slides back on so that you guys can, you can just flick through the slides again so that you can read. Let's have a look. So So I've already gone through all of this, but while I'm waiting for any questions that people may have, so I could actually post, well, I could have the slides up again. So these are the key things you should bear in mind as you go about finding your work experience. This is how the university will use your work experience. They want to see the evidence, of the commitment to care and evidence of engagement and interest in your wider community, evidence of giving back to your community, especially if you volunteer and get hands-on, as opposed to if you're shadow doctors. They want to see that you're motivated and you do have a keen interest in medicine or a career in healthcare. They want to see that you've gained a realistic view of the medical field or of life in the medical field. And I say life, I don't just mean a career, because medicine, it's not a job. It's not just 9 to 5. It's I'm just gonna have a look. I think I've got some questions. Oh. Let's have a look for questions. Just gonna have a look in the chat section to see. Right, let's have a look, see what questions I actually got. Just been told I've got some questions somewhere, but I seem to be having trouble viewing them. There's nothing showing up just here. So if you just bear with me, I'm trying to find where the questions might be. I think I see it. Tips for UK cat. Let's have a look. Okay, so there's a question from Fatima Shah saying, how do you decide which of your placements to reference in your personal statement? When talking about work experience in a personal statement, how detailed do your explanations have to be? Well, in your personal statement, just bear in mind you have got a word limit on that statement and limited number of characters and number of lines, so you can't go into much detail. You need to decide on what skills, what attributes that you want this particular example that you're drawing from this particular placement is reflecting. So if I go back to the example of earlier, I mentioned that let's say you're volunteering as a ward visitor and you spend an afternoon with a couple, and let's say the wife, the lady is this it's a 60-something-year-old lady, and she's dying from ovarian metastasized ovarian cancer. And let's say you want to use the example of how you demonstrated empathy, and you sat down with the husband, with the man, you listened to him, he he had a lot to get off his chest, he spoke to you, you just sat there, you listened, he cried, you helped him to let it out, you got him some tissues, or you did just sit there and hold his hand while he cried, and he had somebody to talk to and get things off his chest. That's showing empathy. And rather than picking things like maybe caring for her, so giving her water or nursing her, you can pick a particular skill. So that can be an example of empathy. And then you just, in a couple of lines, describe what you did, describe what the situation was, and describe what you learned about yourself, how it made you feel. And that's really all you have to say when including an example of an experience in your personal statement, because you can't use a lot of words on that. I hope that makes sense. So you decide which of your placements to reference in your personal statement, going by what skill you want to reflect. That's how you should choose. What skill do you want to talk about, so that you don't duplicate skills, or you're not, talking about the same thing over and over again, which is the same as duplicating. So I hope that helps. Let's see, there's another question. From Annabelle Wiz, you're asking, is it worth doing similar experience as previous just to have a longer time period of doing it? Well, Annabelle, your work experiences should show a variety, because hopefully you would then cover a wider variety of skills and attributes, and a wider variety of environments, and working with different people in different settings. That's what you want to reflect. It's better to reflect that, a variety, than doing the same thing over and over again, unless you have both. If you have both variety and you can do the same thing again, but for longer, then go ahead and do it. But I would say try and do at least one experience for 2 months or longer. 2 months is enough to show commitment, but try and do for longer than 2 months, and then do a variety of other things. So some of them, some of the work experience placements or volunteer roles will have to overlap. You would have to hold multiple positions at the same time to keep up with that, but it's possible. So focus more on a variety of things than just doing one thing, 10,000 times for 3 months. You need to show variety. So yeah, that's my advice on that. So do different experience, and make sure one of them is at least 2 months long. Simon Carr, you say, do you have any tips for UKCAT test? Well, for the UKCAT test, what I did was I practiced a lot. So I bought a couple of books to help me. One of them was this, I think it's by Oliver Pickard or something. I don't remember the name now. It's been a long time ago. But it's a green and white book, and there's an injection on the front or something. And I think it's 1,000 UKCAT questions. So anyway, I bought one of those, and I think I bought an older version as well. So I had a bank of questions. And then there was a different book. I don't remember the name of this one. But anyway, I bought 3 books in total that I worked through. I spent, I think, about 6 weeks preparing for it, working through it, and I would say I spent a minimum of 4 hours each day working on the personal statement. And I mean, I did really well. I got 800 and something in sections, and I did pretty well overall. So you need to get yourself a collection of books. 6med is also really good. And just checking the message, sorry. 6med is really good. You can get an online bank of questions from them. And on the UKCAT website, they also have they have sample questions. Well, I mean, they did anyway. I imagine they still do. They have sample questions that you can use. I save this until maybe a week or a week and a half before my test date's booked. So for the first 5 weeks or 4 to 5 weeks, I'm powering through the books. Once you've done the question, do it again. And when I've done a question, I've done a chapter, finished a book, I do the whole thing again. So I did each book at least twice. And when you redo it, give yourself less time, because obviously you've seen it before, but now the process is, are you able to come to the same answer, working, improving your technique? Are you able to work through that technique quicker? Because with UKCAT, it's about being efficient. You're not thinking properly, you're just guessing, but you're making educated guesses. And there's a technique to making educated guesses in the test, because you don't have the time for it. So it's working through those techniques very quickly and stressing yourself to do it and trying to beat your previous score. That's how I practice for it. And also, and then I did the questions on the UKCAT website, so a week to a week and a half before I did those at least twice as well. And on the day itself, I felt fine and I was able to do it and I did well. So that must have worked. That's my tip on the UKCAT test. Some people say you practice a couple of hours each day. They say give it 3 weeks, or maybe they even say that you can't prepare for it. Don't believe that. That's nonsense. Absolute nonsense. I completely disagree with that. Give yourself at least a month and practice at least 4 hours every day. Unless maybe I was just a bit slow, but yeah, give yourself, I'd say, an average then 4 hours every day and just power through it. If you've done it before, do it again, because if you've done it before, then now you should get 100%, shouldn't you? So do all the books you can lay your hands on, all the questions you can find, just push yourself and you get used to it. You put your mind in that frame, in the right phase for the test, and hopefully on the actual day you won't feel as stressed, because you've stressed yourself way worse beforehand. I hope that makes sense. So there's a question from Rania Lazrak, who said, if you don't have a paid job by the time you apply, is it a problem? No, because it's not compulsory to have a paid job. It really, really helps if you do have a paid job. If you're in the process of looking for a paid job, then you can, if you've already, maybe if you've done the interview, they've offered you the job or something, but you've just not started it, then it's worth mentioning that, over the next couple of weeks or so, you will continue working in this capacity as whatever the job is. But you don't have to have a paid job by the time you apply, no, but it really does help it really helps the application, because it shows additional responsibility on you. Sorry, I'm just having I think I'm having messages about this actually. Okay, anyway, so Rania, I hope that helps. If you don't have a paid job, not a problem. Do other things. You need teaching positions. Teaching position is really good, because if you have an additional skill, so maybe if you play an instrument, you can organize to advertise yourself on Gumtree or Craigslist or somewhere. Just advertise your skills, use the skills you have, teach people, and charge very cheaply. So they're paying you for it. You're using the skill and you're teaching, you're developing your skills even further, and you're exercising your hobby or whatever it is that you're teaching them, or you're keeping your knowledge up because you're teaching it to somebody, so you need to know it like the back of your hand. So if you're struggling to get a paid job, use the skills you have to get paid for it. Otherwise, then just focus on the other things. Get your work experience in terms of volunteering, create something, be innovative, do other things, do an audit, just something else, but you don't have to have a paid job. There's a question from Same M saying, is residential home same as a nursing home? Well, residential home just means that, not necessarily, no, there can be different things, because my understanding of most residential homes is that the people live there and they live there long term. So it can also be, a residential home can be a care home. But a care home is different from a nursing home. A nursing home is where the members of staff are more heavily they're more nurse-led. So the patients require a higher level of care. They're more poorly than the patients you find in a care home, where you just have care workers who may come in and out, or care workers may live there 24/7. They're looking after the patients. In a nursing home, you actually have trained nurses. You have registered nurses looking after them, giving them injections, drugs, and even people in care home may be on drugs. But the the residents of the nursing home will have a higher demand of care than the residents in a care home. Now, people who live in a nursing home are residents of that nursing home, so they can also be called a residential home, but I don't think they're commonly called that. But people who live in a care home, they also reside there. So it's a residential home. But I think people who live in a care home are the ones that are more commonly called residentials of a residential home. I hope that makes sense. So a residential home is more like a care home, where it's more care workers led, and the residents, so the people who live there, the elderly people, have a lower demand of nursing input than the people who live in a nursing home, where they need registered nurses to be looking after them because they're sick or something else is going on. They're just not well enough for a residential home or a care home. So you just need to confirm that with the particular home or organization that you want to work for, because some people call it different things, but in general, it's different. Residential home usually is referring to a care home, whereas a nursing home, the members of staff are trained nurses, because these people need injections and various specialist drugs at specific times. Okay, question from Fatima Shah. Is work experience in certain specialties more favorable than others? For example, in any regarded as better than a hospice? Are you disadvantaged if you don't have exciting placements? No, I don't think work experience in certain specialties are more favorable than others. No. The only way that could be more favorable is if your personal statement is very heavily saying, I want to work in pediatrics, and you don't have any work experience in pediatrics, then it's a bit like, what are you talking about? Then that's not going to help you. But hopefully your personal statement is not going to be that specific anyway, to say I want to work in pediatrics or I want to work in A&E, and so it shouldn't be a problem. Working in one specialty is not more favorable over another. It's really about what skills you gain from that specialty, and this is where the transferable skills come in again. You should be able to develop the same sort of transferable skills in any specialty you work in any hospital or any sort of setting, really. You just have to be there at the right time and you get the right skills. So no, it's not more favorable than another, not at all. If you don't have an exciting placement, it depends on what you mean by exciting. Exciting placement, as in busy, doing lots of things all the time. Well, I don't think you're disadvantaged, because you can still develop skills. You can learn things. You can learn about these stuff. If you mean exciting as in busy, so maybe it's all the patients are fit and well. Maybe the patients on a ward that you're on, for example, are just waiting to be discharged, so that they're not the one that's acutely ill. Then you can spend more time with the doctors. You can see you can ask them. You can talk to them more about their day-to-day life. They can tell you about life as a doctor, so you can build up on your insights in that way. So, or you can spend more time with the nurses, or even nurse practitioners, or the physiotherapists. Spend time with other healthcare professionals and learn from them. So it really, the placement is what you make of it. And if you get bored because maybe the doctor is spending a lot of time just doing paperwork, and you're just sat there and not really learning anything while he's doing paperwork, well, go and follow another doctor and tell him you'll be right back. Just go do something else and make the most of your time. So I think you'll be disadvantaged if you don't make the most of it. If you don't take every opportunity you have, you'll be disadvantaged, because however your work experience turns out is kind of down to you. You're there to make the most out of it, and you can be proactive about these things. You can say, I want to follow somebody else, and they'll generally say, that's okay, come back to me at 5 o'clock or something, and that's fine. So make the most out of it and make it exciting. If you don't find it exciting, turn it around. Go find somebody else. Go find something to do. It's a hospital or it's a care home. There's always something else you can learn about that would be exciting. So does that make sense? But yeah, no work experience, no specialty is more favorable than another. No, and you can always turn your placements around to make it more exciting. A question from Samye M. Could your paid job include working for your dad, or would unis not consider that as good? Well, you don't have to specify that you're working for your dad, do you? I don't think you have to specify that you're looking for your father. It depends on what's the job. Just you'll be talking in your on UCAS. You have to. There will be a section for paid employment, and you say what the job is and how much you earn. I think there's a section for how much you earn anyway. You say what the job is, what you do, how much you earn, and what skills you gain from it. That's all you need to talk about. You don't. They don't need to know that it's your dad or your uncle. No one needs to know that. That's fine. And so yes, it could. Your paid job can include that. It's really about what skills you get from the job and how you develop yourself and how that's actually relevant to medicine as well. Those are the really important things. A question from Simran Carr. What are buzzwords or topics that are currently prevalent in the medical profession in general, if that makes sense? Well, at the moment, buzzwords or topics, this is always changing, but I assume you'll probably be applying sometime soon. So it changes with the times, so keep up to date. But some of the key things at the moment is obviously the Brexit, and how that's going to affect doctors and movement of, the hospital staff, because a lot of them are international. There's the whole NHS is in crisis, obviously, so budgeting and whether or not we should be charging for certain facilities or certain services that are provided by the NHS to make up for the fact that we have no money in the NHS. That will continue to be prevalent because the NHS is becoming poorer and poorer. So money is a big problem. Obesity crisis is still there, it's still on the rise. That will continue to be prevalent for the time being. The Asian population that we have, and the fact that actually there was something news recently. For the past few years, we've been living longer, and then there was something news quite recently about the fact that that is now plateauing out. So we're not sure anymore if we're living longer, but we definitely still have an aging population for now. And of course, this comes with the whole load of comorbidities, so the conditions that the elderly people will have, and the fact that people are having children much later and later in life. So the younger people going into the work first, and we have an aging population. How is the NHS going to cope with this? And how is the NHS going to retain doctors? There are a lot of political things that are currently topical and that you should read about. The best way to know what topics or buzzwords are prevalent is just to keep up with the news. Go onto the BBC website, listen to BBC News. They repeat the same thing in news. They repeat the same thing every hour or so. So you just need to listen at 5 o'clock or something, or 4 o'clock, maybe every day, or just go onto the website, read a few topical stories in the health section of the BBC page, and get an idea of what's going on. But yeah, things that will continue to be topical, NHS spending, the fact that we have no budget, and what sort of ideas can you give on how we can fix that? Should we be charging for the self-inflicted versus non-self-inflicted conditions, and who decides what is self-inflicted? Think about those sort of ethical topics. Since the obesity crisis is still there, and what we can do to solve that, retention of doctors, the Brexit and how it's going to affect us, the aging population, those things are still quite topical. So, and in terms of, there was an outbreak of, try and keep up with outbreaks of diseases and such. All the stories about the Zika virus, that's died down now, so it's not so topical anymore. But the norovirus outbreak that's affected the recent athletic sporting event is interesting. So especially if you're into sports and stuff and you want to talk about, maybe it's one of your extracurriculars, it's a good way to talk about a disease that you've read about recently, norovirus. And there's always an outbreak every winter, but that's kind of topical right now. So yeah, the best way to do that is just keep up to date with the BBC Health page and see what's prevalent around the time of your interview and when it comes to writing your personal statement. Just trying to see what other questions. So, could your paid job include? Oh, we've answered that already. What buzzwords? We've answered that. Do you need to give a referee for your paid job? Oh no, Rebecca has answered that. Dr. Yes has answered that. What activities or things can I do that evidence leadership skill fully same for teamwork? Questions for the company skills. Yeah, I think thank you, Dr. Yates. She's answered your questions about leadership skills and teamwork. I mean, you must do some sort of hopefully you in your extracurricular work, you work in teams to do something, or your school, maybe you're a school prefect, or you hold a position of responsibility. You generally would serve as a leader to somebody. So those are a good way of building that. If you don't have any of such positions, now is the time to go and find it. And actually medic mentor also does you can, if you look on the medic mentor website, you can look into setting up a school society. That's such a massive example of leadership skill. So look, if your school doesn't already have, a medical society, look into setting one up, and there you go, leadership skill done. So yeah, look into things like that. Same, you say you can't think of any examples as a leader. If you don't have any right now, think of setting one up. Think of the attributes of a leader. A leader is somebody who, well, you generally would either create a vision or have a vision that you want the team of people you're directing to strive towards. You're working towards a common goal with your team. You're guiding them in achieving that common goal. You're the one who you set the vision, as we already said. So that's something that you can achieve by creating something. Is that if there's anything you're particularly passionate about, a society, a fundraising event, you can think of setting up a committee to achieve that goal, and there you go. You will have you will develop your leadership skills by doing that. So find something that you're interested and passionate about, and think about taking it further. Think about creating a society or a committee to achieve or to support a cause that you're passionate about. So I hope that helps, Same, sorry, can't say your name. Hmm. Advice on how to, Fatima Shah, you've got a question on how to deal with not feeling good enough, or how to deal with loss of self-confidence. Hmm. Now that's quite interesting, and that's now the way I see that is that that can be quite specific. Not feeling good enough or losing self-confidence in what exactly? You just tell me a little bit more. Is there a particular example that this question is stemmed from? And we can maybe expand on it and be a bit more specific with that example. Because one thing I do whenever I start to lose my self-confidence in any particular area. So, for example, if I feel trying to think of something that's not too something that won't get me to break down in tears right now. Joking. Anyway, for me, one thing I do is I remind myself of my achievements. So if I remind myself of things I've accomplished, I confide in people that I would open up to normally and talk about whatever issue I have or whatever I feel is tearing my confidence down. I usually talk about it with my best friend. And just talking through that actually helps me. It helps me with confidence, because usually she would point out the things I've already achieved, and that reminds me of things I've already achieved, and the fact that actually, no, I've done this, I've done that, I can definitely do better than this. I think one way to go around solving this problem is to try doing X, Y, Z, and I usually end up working through whatever it is that was causing me to lose confidence. I usually end up working through it either by myself or with my friend, my best friend, and that helps me get it back. So can you just be a little bit more? I think I need a bit more information on the context around this loss of self-confidence. Oh, thank you, Dr. Yates. That's a very good answer. Yeah, literally anything that that shows you're not a studying exam machine really helps. Seriously, it does. Even if it's just like going for walks or hiking, because that's one of my hobbies right now. Just hiking, you don't play an instrument, that's fine. Just anything. Or find, if you don't have one, then find one. Now is the time to go find something. Pick up badminton, pick up tennis. Just if you don't have it, start learning it. By the way, Fatima Shah, I'm still slightly concerned about your last question, and if it's because I asked if you can expand on it, but if it's something you'd rather not do in this public chat, it's fine. You can email, well, you can email me actually on workexperience@medicamentor.org, and I can get back to you on that one. I just need a bit more context there before I can give you a proper answer, I think, or to give you a hopefully more helpful answer. But yeah, like I said earlier, talking about it to somebody I normally open to and confide in, and by talking to them, reminding myself of what I've achieved so far, actually does help me rebuild my confidence. Oh, I see what you mean. Okay, so Fatima, you say, although I've done everything and I've achieved lots, I still feel like I'm not good enough for medical school despite having worked really hard. I think it's partly because of the stress and the competition. Fatima, I think you're absolutely correct in that it's because of stress and the competition. And honestly, it's no, I felt that way. No, I definitely felt that way when I applied. So you're not alone in that feeling at all. You're not the only person who feels like you're not good enough. And I think because of the competition, you compare yourself to other. I mean, I did that when I was, in your shoes. I compared myself to other people a lot, and I thought everybody else was so amazing and they've done so many other things and they've achieved more than I have, and I was not enough. But I got here, so that's not entirely true. I think one thing that you need to know is that everybody is different. Everyone's experiences so far, everyone's experiences are different. You need to just look at the strengths, focus on yourself, look at the things you've done, focus on your strengths, and just talk about that in your personal statement. Talk about that in your interview. Don't compare yourself to other people. Compare yourself to the doctor that you've seen. Compare yourself to the sort of doctor that that the medical school you want to go to want. Check that you've definitely got everything it takes, and chances are you probably have, because you just said you've achieved a lot, you've done everything, so you probably have got everything then. Now you have nothing to worry about. So you just have to make if you feel like you're losing confidence, one good thing to do is just fake it. Look in the mirror, practice self affirmations, look at yourself every day, tell yourself that no, you deserve it, you've come this far, you've achieved those things, you're powerful, look at everything you've done so far, you're definitely worth it. And you have nothing, there's no reason for you to lose self-confidence. But it's so common and we all feel that way because we compare ourselves to other people and we really shouldn't. So practice self-affirmations, talk to yourself more, talk to your family, people you confide in, people who definitely recognize you, because there are people who will look at you and actually think, and they'll be intimidated by you because of your achievements, because you just said you've done it and you've achieved a lot. So you may find other people intimidating and think you're not enough. But there are people that look at you and find you intimidating because they think you're too much. So it's okay. We all feel that way, but you just have to bring it back. Stop comparing yourself to other people. Just bring it back to yourself. Focus on you. You've got everything down. Look at what the university want. Compare yourself to what the university want. Check that you've ticked all the boxes. You've got everything down. You know what you're doing, and just continue to do the best that you can in your own way. That's all you have to do. You're really, it's hard to tell somebody that, you know, you're in competition with yourself, because you're not. They are comparing to other people, and that's how they decide who gets in. It's true, but if you focus on yourself and you continue to be in competition with yourself, you will strive to just do better and better than you've done so far. And you can't really compare yourself to other people, because people only show you what they want to show you. You don't know the full story. You don't know the full sides of other people. You can't really, it's not a fair comparison, but you know yourself. You know the full, you know all sides of yourself. You know what you've done, and hopefully you know that you're capable of a lot more. And so you will continue to compete with yourself. So that's what I think, that's what helps me. That definitely, you know, in that feeling, that's a familiar feeling, and I still get it. I definitely, especially because it's exam periods, or whenever I start to stress, I still get that. And you know, you just have to remember. Well, for me, I keep reminding myself, no, I've done this, I've come this far, I've achieved so much, I'm better at this, and with every step I take, everything I do, every time I stress over something, I work harder at it, because I'm worried. But then I just try to think, actually, I'm in competition with myself. I don't need to think about other people. I don't need to compare myself to other people, so that I'm not losing my self-confidence, because I'm not comparing myself to them. They're good at what they do, yeah, but they're them. I'm good at what I do, and I'm me, and we're both completely different. We have our own separate, you know, it's like, I've heard there's a term called queendom. So they're the queen of their queendom, and I'm the queen of my queendom. That's generally how it works. Everybody is unique, and you're unique in your own way, and you can just continue to be the best of yourself, and you have nothing to fret about. There's no reason to lose self-confidence, but it's a familiar feeling, not to worry. So keep doing what you do. You've achieved a lot, you've done it. Yes, that's good. Keep doing it. Keep up with the hard work. Very good. And just continue to get better than you're doing. Compete with yourself. Forget about other people. No need to stress about them. Just look at yourself. Look at what you've done. Try and get better than yourself. It's all about you. It's not about them, okay? Just stop comparing yourself to others. I really hope that helps. But no, you're not alone in that feeling, Fatima. You're so not alone. And yeah, I'll definitely check out that Twitter link, actually, that Rebecca and that Dr. Yates has just posted. Doctors who almost quit. Yeah, I'm going to check that out. I really hope that helps, but no, you're not alone in that. It's like, welcome to the medical field. that's the normality here. But no, you just have to remember that you're amazing, and you sound like you're doing all the right things. You know, you've worked hard, you've done everything, you've achieved a lot. You're good. You're more than enough. Okay, I think that's probably all questions for now, because it seems it's gone really quiet. And oh, Fatima, you're welcome. Don't worry about it. You'll be fine. Best of luck, Fatima, and to all of you guys. Thank you for listening. And yeah, best of luck, guys. If you have any more questions, you can just. I really like that comment, Fatima. You've told me now. You've got this. You sound like you've got this. Don't worry, Fatima. If you have any more questions, any of you, you can just
work experience at medicamentor.org, and I'll try and hurry up and get back to you all. Okay, well, best of luck, guys. Thank you. Bye.